very excited to be here to talk about virtual care, also known as telehealth and the future of medicine. So, for some background, let me give you a glimpse into my life circa 2014. I would wake up, I'd make coffee, I'd log into my telemedicine platform, and then I would see patients from 22 different states. They'd be at home, they'd be at work, they'd be at their vacation spots. It was busy. I saw a lot of patients, met a lot of people. I improved my geography. I wasn't afraid for my safety. But most importantly, I actually learned about the different healthcare access gaps. Some of them are universal, but some of them are regional and very specific. Something that I didn't know coming from an almost all urban living and training environment. It was fascinating. So thinking about these experiences, thinking about what is it useful for me to talk to you about, things that I could talk to you about. I could tell you the basics of telehealth. What is it? How do you do it? How do you get involved? What's the malpractice? What's the reimbursement? What's the research? What are the regulations? What is until you all just fell right asleep? Because it would be very informative, but it's not going to inspire you to do it unless you were already invested. Then I thought I could talk to you about how I got into it. It's a classic burnout story. I was working in an overly busy ER. Did it for years, and I slowly started turning into someone that I didn't recognize and didn't really like. And so I had to really think about the fact that a field that I loved intensely was maybe not good for my health. And so I took a chance. I joined what was then a small startup, started working in health technology, became a virtual care doctor, a TV doctor, somehow ended up in academics, and then created a career I didn't realize I wanted, and became much, much happier, as evidenced by this very real before and after picture. This is not me and my fellow running around campus, him with a camera, something I left out of his job description. But today I'm not going to talk about any of that. We're not going to talk about the when, the what, the how. We're going to talk about the why. Why is this important? Why is this good for you to know? Why is this not going to prevent you from connecting to your patients, and why this is not going to turn you into a machine? So despite what I just said, I should probably give you a basic definition of telehealth. Some of you probably already do it, but maybe not. So essentially, it means having a remote medical encounter using technology between two parties. The most common ways are provider to provider and provider to patient, like the example I gave you of the job that I had. It can mean telephone, chat, and pictures, but I use video in the programs that I work in and run, so that is the standard I'm going to be using. Now, I'm well aware it's not groundbreaking for me to tell you you can see patients on video. Of course we can. We do this every day of our lives, right? We see our friends, our family, people around the world. This is just what our life has become. But what is interesting is remembering that telehealth does not exist in isolation. It's part of a larger movement. It's part of a bigger group that includes apps, devices, artificial intelligence, machine learning, virtual reality, augmented reality, genomics, all things that are leading us to more personalized medicine. This group, broadly called digital health, has the aim to make the home a bigger place of healthcare, leverage hospitals and clinics for sicker patients, and lead us all to a more equitable and accessible form of health. So as promised, why should you guys care? Well, the first reason is our patients are going to want it. Consider the fact that healthcare is really geared around us. Our patients have to come to us for all their healthcare needs, our clinics, our hospitals. Now, of course, that's necessary. We need that for procedures, surgeries, critical patients. But really, all of our events, our choices, our health happen outside of that. They happen at home, outside the small slivers of time that we have access to our patients. So leveraging some of these technologies, things like sensors, bridging them into the healthcare system can create a better home-based healthcare. I can't stress enough how much you can tell about somebody seeing them in their home environment. I've seen potential allergens. I taught someone how to put on their knee immobilizer correctly when they couldn't figure out why they couldn't walk. I saw a kid retracting on a beach in Florida and told the mother that they needed to go to the ER right then. On the flip side, I saw kids with croup in the middle of the night, and I was able to give those parents things they could actually do at home to keep that kid out of the ER. I kept people out of clinics when they lived 2 hours away. I was able to leverage family members to do an abdominal exam on the patient to explain to both of them what I was looking for and what I considered important and what I didn't. Yeah, that example always makes people nervous. But I was able to do that. I had time. Now, of course, some people worry that we are going away from a human connection, that this is going to make it more difficult. That isn't true. There is nothing more personal than being with someone in their home environment, seeing where they are. And I was able to do it. I felt no reason not to be able to connect. It just takes practice. And I was able to learn a lot of things about what patients don't understand about their disease process. And that is what changed my practice. Which brings us to the next reason this is important. It's going to change our whole healthcare system. What we're able to do, what becomes efficient, what we have access to. So I told you about how we do telehealth provider to patient, but consider provider to provider. We always think about healthcare access only as an issue with patients, but sometimes our colleagues are isolated as well. So telestroke is a good example of provider to provider healthcare, or excuse me, telehealth. So think of it as a doctor who may not have a consultant or access to a consultant. They can actually now see one on a video. That consultant can do an exam over video, take a look at the workup, and give a plan of action. Now, sometimes that plan of action is transfer, but other times that allows a patient to stay at home, gives the doctor who is in the community a plan of what they can do to take care of that patient there. So the patient can stay near their family, they can stay near their friends, and that community can benefit as a whole. Now, this version of telehealth in various specialties is practiced all over the world. It improves patient care and has our colleagues feeling much less isolated. It's also going to make more things more automatic. We're going to see more patients at home. Now, of course, I know there's skeptics. How can a machine really read x-rays and CTs? Can an algorithm really triage patients to a level of care? Can you really do an exam over a video? And what's the iterative reliability about that? Sure, I understand that, but think about EKGs, right? We don't manually read them anymore. In fact, I probably don't even remember how, honestly. But the point being is that it was validated by a bunch of cardiologists. We've learned to trust it. There's no reason to believe that that's not going to happen with any of these things if we are diligent about how it's used. And the one thing about computers and machines that doesn't happen is that they don't start missing things. They don't start feeling tired. They don't get exhausted. They don't overwork. Things that lead us down the path of disaster where we've all been. Now, of course, they're still going to be necessary. We need to interpret that data. We need to apply it to patient care. We have to understand it so we know that we're doing the right thing. And of course, most importantly, we need to be there for that human connection. We need to hold their hand, explain things to them, teach, oversee, give the bad news, because that is something a machine can't do. But that part of medicine, that human connection, is actually what I would rather spend my time doing. Which brings us to my last reason. It's going to change our whole healthcare system. We are going to have that time. Healthcare, just like all parts of our lives, is going through a massive transformation. Some of these things seem very far in the future, but some things are only 5 years away. Telehealth is already here. The way that we practice today is not going to be the way we practice near retirement. Our students, our residents are certainly not. And you can already see it. My digital health students, they don't need help understanding technology. They grew up with it. They need to know how to apply it to healthcare. They need to understand how you validate it. How do we make sure that it's safe for patients? They also don't find virtual care particularly scary or exciting and don't see why we wouldn't use it. Just like two of my second years I have pictured here doing a project on the use cases in urology. But all of these things, right, it also relies on us. We have to determine what is it that's safe. And so I invite all of you to be part of that change, because if you don't, if you're not the ones who decide this is what we need to use, this is what's effective, this is what patients need, it will be dictated to us. As in a big example that people complain about that I'm not going to talk about. But the point is that we have to challenge ourselves not to fear being irrelevant, to fear the fact that we may have to practice differently than we have, the fear of change. Change is happening all the time. It doesn't matter. It's inevitable. Our choice is whether or not we want to be part of that change to be able to impact the future of healthcare in the way that we want it. So this is why it's important. But let me tell you why I do this and leave you with this. Why is it that I spend my time in telehealth advocating for it, teaching it, and talking about it everywhere I go? Well, as anyone who probably went through any sort of burnout symptoms can attest to, when it happens to you, it makes you really think about, how did I become a physician? Why did I do this? Is this really what I want? So I did think about it, and here's what I realized. I do. I think being a physician is a gift, and I can't imagine doing anything else, emergency medicine specifically. But seeing a patient in fear, in crisis, in pain, always thinking about things in terms of life and death, it really makes you look at what it means to be a human. It really affects you at a fundamental level, and it affects how you look at the world. And so I realized there's things that I can't do. I can't always explain the structural things that bring people to me, what brings them into the ER for certain things. I can't always tell people why things happen. I don't know why bad things happen sometimes. I don't understand why some things happen to some people and not others, why some people have easier life paths, why some of the structures are unfair against people. That I can't explain. But I understand what I can. I know that I can, even over video, connect with a patient. I'm able to give them real things I can do when they're afraid or scared or can't navigate the health system, feeling isolated, whether it's geographically, physically, economically, and I can do that. I can teach others how to do that. I can teach all of you how you can do that. I can try to convince and inspire my colleagues that this future, this healthcare future, is not going to be bad, but try to get you to be part of it, to try to advocate for your patients. This is important for us to be part of and for the future generations. Because without that, without us, these are just devices, just gadgets. It's a webcam. It's just stuff. So being part of this change, understanding telehealth, working in it, training, all of these things, understanding its limitations, but also seeing the tremendous potential it has to improve our patient outcomes, improve our health access. This is what brought me back to medicine. It brought me back to life, knowing what it is that I can do. Thank you.